Hello, one and all. My name's Sandy, and I'm a clinical hypnotherapist plus a counsellor. And I'm looking at the moment, I'm doing training in psychedelic psychotherapy. Psychedelic assisted therapy is what it's called officially. So one of the things is that it's been a bit of a buzzword and a buzz thing for the last couple of months, maybe the last couple of years, but essentially it's been around for a very, very long time, back to shaman, all the rest, about healing through psychedelics. One of the things that I'm finding at the moment presenting in my rooms are people that have had not really very good experiences, even in the psychedelic area, because they're now going to cowboys or underground therapists that are not particularly well trained or don't really have the depth of understanding of what psychedelic assisted therapy is. The reason it's come to light a lot is of recent they've started doing clinical trials, have been done over in America for quite a long time, but I know that they're doing them more over in England, and they are obviously doing them in Australia at the moment. They're doing them in at Monash, and they're also doing them Monash in Melbourne and also up in Sydney that I'm aware of. And a lot of the psychedelics that they use are magic mushrooms, so psilocybins, and they do MDMA. Plus, there's other stuff which hasn't been that they're not trialling just at the moment. Things like DMT and LSD, etc. In a psychedelic assisted therapy, you're dosed, etc., in the room, and there's lots of work that goes beforehand, during, and after. It's not like being given a antibiotic and say, here, take this and go home. For a long time, ayahuasca's been around. But what I was saying is that I'm finding that in my room, and I know other therapists are starting to face people that are, looking to do therapy, and they're going places that, because it's not legal yet, that people are saying that they can do this work, and they literally cannot. So they come at it with what is classified as a bad trip, where the integration or what was meant to be occurring in that space, it doesn't happen, and they've left with some, damage to their psyche and not knowing how to translate that into their world. So obviously I'm an advocate for psychedelic psychotherapy, and it's an amazing, amazing world, and I cannot wait until it's actually legalised within Australia, and that it becomes more widely available. The stuff that's happening in that zone is just mind-blowing, literally. I mean, it's funny that I'm saying that, but it is. With what's happening with people with complex post-traumatic stress disorder, with anxiety, addictions, fear of death. They use a lot with people end-of-life sort of areas and stuff like that. But I'm more than happy to talk a lot about this zone. I like to talk about it in a very positive way, but I always put this warning out there. This is when you're looking at therapy and using those drugs, we're not talking about going off and partying. We're not talking about long-term use. Often it can be a one-off, and people experience life-changing events that are very, very hard to explain. but then they no longer experience PTSD and anxiety, depression, etc. Which as I say, I'm bustingly excited. I've been sort of reading, sort of on the cusp of this for about 9 odd years, and to see it sort of coming to fruition and them doing stuff, it's exciting, especially, and all of us that work in any therapy want the best for our clients, so when you see something that's got legs, so to speak, you sort of go, come on, but like everything, waiting, and it's, that's sort of, this, not so much the start of that journey. As I say, shamanism's been around in all cultures, and they use it. It's not just, they're not parting with those sort of areas. They're highly trained tribal people, and those drugs are used for reasons. They're not just there going, hey, let's, do this. It's, for journeying, for exploring, etc. But as I say, look, I'm more than happy to chat about this area. It's a breathtaking area, but I always put in here, word of caution. Don't go off doing it yourself. That's not therapy. You can't do that sort of therapeutic work by yourself. Make sure that even if you're going to sort of dip your toe into psychedelics, do some research. Make sure you're with people that you trust, that can, if not therapeutically, but can be there to just help you. So even though I sort of, sort of make that sound, I'm just saying be wary. Don't just head off and do stuff. You've got to make sure you're well supported. Whether it be partying or whether it be in a therapeutic session, you've got to make sure you're with the right people. And I'm really happy to, as I say, talk about that more. But just know that there can be adverse side effects if you're not well prepared, if the person that you're working with is not well trained or well prepared to also. I'll leave it with that and hand you back to Jo and our new mystery presenter, who I'm not sure who it is yet. So I'll hand you back to the boys, and I will every once in a while drop in and have a bit of a chat. I'm so excited at the prospect of people that have had terrible addictions, whether it be alcoholism or anything else. These prospects of things changing, and there's movement in the air. So keep tuned. It's exciting space. All right. Lovely to talk to you all. Stay safe.